Thank you very much, Ranjini, for your kind words. It's always great to hear about ourselves from our students. Wish you all the best in all your future ventures. Um, Firstly, I would like to express my deep felt gratitude to Dr. V.Mohan and his team for giving me this wonderful opportunity to contribute a drop in the ocean of knowledge that is being shared by all these stalwarts from across the globe. I appreciate the organizing team for having scheduled this talk on dietary modulation of GLP-1 immediately post-lunch. Part of my job has been made very easy by the pre-lunch panel discussion, where a lot of inputs have been shared by eminent experts on diabetic specific nutrition, and in between every one of us have heard the word of GLP as well. So if any one of you find the contents on my slide interesting, please go ahead and click photographs. I have no conflicts of interest, and whatever research I have cited in my presentation is duly acknowledged. And any avoidance is purely unintentional. And these are the subtopics that I had planned, but having said that, some of the details have been covered. I will not, it looks long, but it will be brief as per the timing. So for those of you who are not well versed with GLP-1, just very quickly, let me just begin the talk by saying that this is an incretin hormone produced by enteroendocrine L cells located throughout the intestine. But what we need to remember as nutritionists is, where are the maximum number of L cells? That is one point we need to keep in mind. So towards the large intestine, more number of L cells are located. Okay, so that is one point. Secondly, what exactly stimulates the GLP-1? There are neuroendocrine factors which will initiate the GLP-1 secretion in the gut. However, as you can see, majority of the amount of GLP-1, the synthesis is stimulated by nutritional factors. That is where the idea of the topic has come from. And several functions of GLP-1 are realized, and partly most of these functions have been already mentioned. The angle from which we need to understand this as nutritionists is there any impact of GLP-1 on the food that we consume? So that is important. Later on we will see how food can influence the GLP-1. Yes, definitely, because it is not just helping in the normalization of blood glucose level through pancreatic route. Even the neuronal regulation, by playing a role in the hypothalamus and NTS, it is also regulating our dietary behaviors. Most importantly, it is going to reduce our urge for consuming HFSS foods. It will be wonderful if at all we synthesize sufficient amount of GLP-1, probably automatically our interest in consuming high fat sugar foods would go down. Hopefully it should happen. However, there are several factors listed over here, and right from morning, these factors have been held responsible for increasing incidence of diabetes and various other diseases. So there is a negative association between GLP-1 concentrations and each of these factors. So the influence is mutual, especially when it comes to faulty dietary habits and of course altered gut microbiome and poor lifestyle. There is a positive association between GLP-1, good dietary choices, food intake, weight loss, and glycemic control. So a lot of factors have been associated in various scientific studies, and it has been proved beyond doubt that GLP-1 is definitely very important for the body. But because these factors are decreasing the GLP-1 production, let us see if there are any strategies by means of which the concentration, the synthesis and its release can be improved while inhibiting its degradation by the DPP-4. And it has been explained by the other experts here over the strategies that are being used, probably through direct GLP-1 treatment or GLP-1 RA treatment. So it is going to increase the secretion of GLP-1 from the cells if they are RAs, and Biological half-life of GLP-1 is just 1 to 2 minutes. It's very, very short. Okay, but that can be improved if you are able to extend the degradation of the same hormone by enzyme DPP-4. So, which can be done by the RS, and you can also activate the GLP-1 receptors, which are present almost all over the body. That is the reason why there are functions beyond pancreas and the brain. There are functions like anti-inflammatory, cardioprotective, neuroprotective, and even renoprotective. So that means the receptors are present all over the body. So activating the receptors is another way. If all these three strategies can be implemented together, obviously you can have excellent activity of GLP-1 in the body, which is very, very beneficial. How do you implement these strategies? You have pharmacological solutions, but as a nutritionist, my focus is definitely on dietary and lifestyle solutions. So when we talk about the diet, it's very important. I personally also believe that we should first understand the role of nutrients in whatever phenomenon we are talking about. Then the nutrients which are being extracted from functional foods and being researched so much, that is the functional foods along with phytochemicals, and then we are not going to eat phytochemical extracts, neither individual functional foods as a meal. We are going to eat a meal where all these things are put together in the form of food. So obviously we need to understand more about diet composition, whether we will be able to make a change in the diet composition so as to improve the GLP-1 secretion. And then there was some mention about what to eat first and what to eat next. So there is a meal sequence. Why I have selected these factors is these factors are, each one of them has been extensively researched, and there is strong scientific evidence for the role of each of them in GLP-1 modulation. Nothing to talk much about the digestible carbohydrates, because anyway they will definitely be digested in the small intestine. So where is it digested is more important. Where is the action of digestive end products happening in relation to GLP-1 is very important. So since the digestible carbohydrate is going to be completing its digestion in the small intestine, the effect will be only on the L cells situated in the small intestine, which are small in number. So there won't be major contribution of these sugars to the GLP-1. So we don't have to increase sugars because it is going to improve our GLP-1. Whereas the non-digestible carbohydrates, definitely they are a boon of nature for us because they are naturally present in most of the foods. And whether you consume them either in the form of probiotics or symbiotics, most importantly, the fermentable soluble fiber is the one which is going to play an important role, because that is the substrate for the gut microbiota. It is not that the soluble fiber directly is going to target your L cells in the large intestine to synthesize GLP-1. No, it is the gut microbiota who are going to ferment these fibers, produce the miracle compounds called short chain fatty acids. Innumerable benefits of short chain fatty acids. Any health conference you go, SCFA are always spoken about. So here, what are their benefits? They are actually doing all the strategies that we have discussed earlier, which were implemented through pharmacological solutions. In addition to that, they can also increase the conversion of proglucagon, which is a precursor of GLP-1. So, which is very important role of short chain fatty acids over here. By the way, SCFA can bind to GLP-1 receptors even beyond the gut. So there also they can improve the sensitivity of these receptors so that GLP-1 action can be well performed. And then you have scientific evidence of enrichment of diet with soluble fiber. I have quoted only one study over here where a psyllium enriched meal has shown a significant impact on the GLP-1 response. But what is more interesting is the other type of fiber, insoluble fiber, which is not very friendly to gut microbiota, has also been shown to improve the GLP-1 response, but the mechanism is still not very well understood. Of course, we cannot leave fat anywhere because most of the foods are cooked with addition of little or more oil. And most interesting is lipids have the highest influence on GLP-1 response. Of course, this is really a startling fact. And all the varieties of fatty acids can increase your GLP-1 response. But again, where are these fatty acids produced post-digestion? Which part of the gut? Again, small intestine. except I'm not talking about short chain fatty acids, the fatty acids that we consume through lipids in the diet. So when the dietary research is looked into, most importantly, the MUFA and LC-PUFA are the ones which are showing significant impact on GLP-1 production by the L cells, even in the small intestine, so which adds on naturally to benefit. But as nutritionists, we definitely have to exercise a caution with regard to the role of sugars and fats. Okay, of course, we have to meet the requirements of LC-PUFAs and MUFAs. Later on, we'll come across whether enriching the diet with MUFA-rich oils would be would offer us any benefit. Of course, we cannot do away without discussing protein. It has been already, it started catching the attention right from Dr. Anjana Mohan's talk to the pre-lunch panel. So research is happening, and the role of protein is extensive. It's in fact extensive, and lot of studies are proving very, very positive outcomes of high protein consumption. And here there are several studies wherein only single amino acid supplementation has been used, and among them the better ones cited by the scientists are L-arginine, glutamine, and branched chain amino acids. When it comes to L-arginine and glutamine, obviously you need to go for single amino acid supplements, because through food you will not get that much of dose to have its own effect. Whereas BCAA you can get from dairy proteins, and the best source for it is definitely whey protein. And if it is a hydrolysate, the concentration is obviously more. So when there is a comparison between the protein hydrolysates, the best one is obviously the whey protein hydrolysate, followed by another non-vegetarian protein hydrolysate, that is fish protein hydrolysate, whereas the vegetarian protein hydrolysates are coming next to these two non-vegetarian proteins. So quickly moving on to the functional foods, I won't spend more time on this, because there are so many anti-diabetic functional foods and anti-obesity functional foods. More or less they overlap with each other. And so lot of research has happened in this area as well. But one benefit of bitter gourd has been like proven beyond doubt for its anti-diabetes benefits. But one benefit with regard to GLP secretion is that it improves, it promotes the regeneration of L cells and also its proliferation in the gut. That is excellent, and this benefit has been offered throughout the intestinal tract, including small as well as large intestine. So it is definitely going to be very, very beneficial for us. And lot of functional foods are shown to inhibit the degradation of GLP-1 in the blood. So thereby we will get, if the concentration is more, we will get prolonged benefit of GLP-1 beyond the gut as well. So that is where we have that pancreatic route benefit and neuronal route benefit. Now phytochemicals, of course, it is not, I don't call this exactly food-based approach, because these are most of the studies are on extracts of these phytochemicals. But what should interest us as nutritionists is the sources of these phytochemicals. You have several fruits, vegetables, etc., wide variety of them, from which every day there is a novel phytochemical that is being extracted, and almost all the phytochemicals are definitely antioxidants. Besides being that, the benefits related to GLP-1 secretion, as you can see, are seen. And what is more interesting when it comes to phytochemicals is the cumulative or synergistic effect. When you provide these phytochemicals along with probiotics, as you can see, resveratrol. So the combination is going to give much more significant benefit for GLP-1 response rather than resveratrol alone or probiotic alone. So the study designs are very beautiful. So here probably we should look into that, how, in what combination we want the patients to consume the phytochemical rich food sources, okay, with probiotics. Of course, variety matters. This is where India definitely tops the list. We have a rich traditional cuisine where multiple varieties of spices are used in a single dish. Single recipe like sambar, if I quote, you have varieties of recipes, spices combined and added to vegetables and dal. So beautiful combination. Across the regions in India, we have so many such combinations. Then usage of that has to be encouraged by the patients, because the studies are proving a positive impact of these such combinations. So definitely the variety is very, very important. Now, after finishing with phytochemicals and other individual nutrients, etc., let's see what kind of meal composition would be beneficial. Dr. Anjana in the morning session has clearly mentioned about the concerning protein deficiency across our country. Not only across our country, in most of the countries, protein deficiency has been seen. In our country, the other worrying factor is the quality of protein which people consume. So here, the studies are definitely indicating added benefit of consuming high protein, low carbohydrate meals. So this needs, and the research has mostly happened in the Western side. So the meal-related research is little less that is reported from our country. We definitely need, because the composition is very different. Indian food composition, Indian meal composition is very, very different. We need evidence-based information from that angle as well. But however, one fact is clear, that high protein, low carbohydrate meal is definitely going to be more beneficial. And then what can we do to such a meal to further improve the GLP-1 benefit? That is, you add all those functional foods from which the phytochemicals have also been proven beneficial, and as a food also they have been held high for their benefit on the GLP-1 secretion, like berries and virgin olive oil I have seen in many studies. And in fact, the Mediterranean diet by itself is considered to be very, very healthy because of its phytochemicals and fiber, etc. But enriched with virgin olive oil, it is offering much more concentrated benefits on GLP-1 response. So this is something very interesting. So we can look into this kind of stuff, because nowadays in India also olive oil consumption is increasing, at least in some sections of population, not in all, because it is definitely expensive oil. And high protein, when we say, we cannot just talk about just a word's sake. How much high is high? So the studies have proved that at least 30% of total energy has to come from protein, which is too much of a protein. But when you actually, when a dietitian plans the diet, personalize the diet, and then look into how much amount it would be to calculate the 30% of protein, part of it can definitely be obtained through the foods, the natural foods, but probably we may have to depend more on supplements. And what supplements and to what extent, let us see which supplements were found to be more beneficial with regard to GLP-1 secretion. Before that, the meal sequence. There are 2-3 different opinions about sequence of meals. Most of the studies are showing protein first, followed by fat, but in India we don't consume fat separately. Very rarely there is, nowadays I am not seeing that practice of adding oil or ghee when you are eating some food. It is rare, but it is not together, but it's separate. So separately we cannot suggest to the patients, because it doesn't sound very practical for us. So the protein rich recipes to be consumed first, followed by carbohydrate rich meal. Then is it immediately? We will answer that question little later. So when protein based meal or recipe, when we talk about what kind of protein, there is a very beautiful study here. So they have provided protein through fish and meat. As you can see, it is red meat, obviously rich in SFA, and Dr. Shashank Joshi also mentioned that nowadays the fat is within the cell, not outside as a layer of covering, so you cannot remove it. So here there is improvement or increase in the GIP as well as GLP. And if the source itself is offering you so much of saturated fatty acids, then obviously the GIP will facilitate accumulation of that within the adipose tissue, which is not wanted for type 2 diabetes patients. So obviously our preference should be the other source like fish, where you have multiple benefits, not only protein, along with that you even have LC-PUFOS in that. So the protein matched meals were tested for this. So even this is actually suggesting protein first, followed by carb. Then some of the studies like this, wherein vegetable consumption is also there. Vegetable not in the form of a recipe, but in the form of salads. So when it is salad, of course, I should quote maybe from my personal side, not to add all salt, so much of sprinkled salt on the vegetable, etc. Maybe with some mixed spices on that. So vegetable first, followed by protein, and followed by rice-based preparations. And there is also some duration or some gap that has been mentioned by scientists, that at least it has to be 15 minutes gap between the vegetable, protein, and the carbohydrate. So you will have to literally space out. This is actually disturbing the pattern in which India consumes meals, the major meals. But however, change, if it is inevitable, it has to be there. So I'm not going to speak anything about RAs. Much has been spoken. Even this picture, Dr. Joshi and team have already shown it. So the GLP-1 RA-induced nutritional concerns have to be addressed only through holistic lifestyle management, which is including the nutritious diet along with correcting the sedentary activity and also correcting the circadian rhythm. This is something missing. Like, no, I have not heard of this till now. It may be mentioned later on. But good sleep hygiene, good quality sleep for appropriate duration, even that is going to influence your the way how the body uses the food. Just one more minute, I'm extending. My apologies to the chairpersons. So I'm just concluding here that the gist of it is like good quality, high protein, soluble fiber and pure-rich diet, smart meal sequencing. Unfortunately, due to time constraints, I could not elaborate more on that. Selective amino acid, functional food, as well as phytochemical supplementation. These are required to improve our GLP-1 secretion in the body naturally by following only food-based approach. And when do you need it? Not only when after the person is diagnosed with type 2 diabetes mellitus, even to prevent that, even for people with a strong family history of diabetes mellitus, it is always better to maintain the GLP-1 levels in the body so that probably you may be able to prolong the disease. With these few words, I thank the audience for your patient hearing. I hope your GLP-1 is taken care of well. Thank you.
Can we have the active applause, please?
Thank you.